It's a people, it's a community, it's a life, it's a heart, it's a spirit.
The heck would you want a picture of a tattoo of $1,000 on your penis for?
The medications that have now come out really make HIV a manageable disease.
Like I said, in today's market, real estate alone has gone up 15%.
Right, so sometimes there is no battle. Lately, if I don't get my musket dirty, that's great with me.
The cops were pushing her and egging her on to get her nuts. They were calling her names.
And then I find that the actors and actresses, for the most part, are like sponges. They soak up whatever you get back to them.
And he kept explaining to me that I wasn't gay, that you cannot be gay.
Religion and spirituality are big, big topics these days. I mean, the bookshelves, the bookstores are full of them.
Incest, not funny. Midgets, not funny. Incestuous midgets.
You are watching Talking About, and we are talking about glaucoma tonight. My guest is Edith Marks, author of Coping with Glaucoma, and we were just discussing surgical treatment options.
Right, okay. So if the drops don't work, and there are many drops at this point. When I first started with my glaucoma, there were just a few. But now there are a lot of drops, so that doctors can keep changing off to the various drops. One of the most popular now are the Zolatan and Travatan, which are prostaglandins derivatives, and these seem to cause the least distress. They make the eyelashes grow longer, and people kind of like that. And until these drops came on the market, the beta blockers, like Timoptic, this was the golden drop that they all use. The gold standard.
Okay, what is a beta blocker?
It blocks a certain area in the eye, and what it does is it. Let me see if I can explain this in a way that's. It blocks the fluid in the ciliary body. It kind of blocks it from making so much fluid.
Stops production.
Yeah, not completely, but it slows the production down.
Okay, so think of
so
it as
it works on these beta cells.
Sort of the OPEC of the eye.
Right. Yeah, right. So this is what the beta blockers do. And what the prostaglandins do is they push the fluid out of the eye. And so sometimes the two of them work very well together. Part of the reason is to stop as much fluid as you can, because otherwise it's going to back up. Well, when the drops stop working, when there just is no other alternative on the drops, the doctor will offer laser treatment. And what laser treatment is, excuse me.
So, laser treatment.
The doctor makes tiny little scars along the periphery of the trabecular meshwork. They're not terribly sure why this works, but it does. It lowers, in most cases. Unfortunately, one of my colleagues just had it done, and her pressure went up, which is very unusual. But sometimes this happens. With the laser treatment, you still have to use drops. It generally lowers the pressure about maybe 5 to 10 points.
Is this an inpatient or an outpatient procedure?
They're all outpatient now.
Oh.
Yeah. So it takes 20 minutes to do the laser treatment, and then the doctor has you sit in the office for about 3 hours to make sure that the pressure doesn't go up. And there's some kind of medication that you probably take after that. Now, this will last 5 to 7 years.
Okay, so there's a good success rate.
There's a success rate. It will last 5 to 7 years, but then you're back to where you were before. Your pressure now starts going up again. and the doctor may do the other half. The doctor only does one half of the trabecular meshwork, and then he'll do the other half, and maybe you'll get another 5 or 7 years. But at that point, the doctor may decide that you really need to have an operation. And the operation is making... really not going to go into the description of it. It's a little complicated, but it's making a hole so that the fluid can flow out of the eye.
So it's creating a drain, really.
Unfortunately, the eye does not like to have a cut in it. Just like if you cut your finger, it's going to heal. So the eye wants to heal this, and it very often scars over. This has been a problem until, maybe about 10 years now. They found out that they could use a couple of cancer drugs, 5-FU and mitomycin C. And when they apply these drugs, tiny bit, to the site, it kills those fibrin cells that would otherwise scar, and so the trabeculectomies have a greater chance of not healing, because if they heal, they scar, and then you're back to where you were before.
This is just a case where healing is bad. Yeah,
healing is bad in this
the
case.
immune system is working against you.
Right. And if you're lucky, your trabecular meshwork, your trabeculectomy is going to maintain, and you're going to have a decent pressure. If you're not lucky, you may have the problem again, and it will scar over. So this is a problem that people with progressive glaucoma face, and it's not a happy problem.
Does repeated surgery increase risks in other areas?
Yes, it does. Repeated, and it is also less effective. And there are only so many surgeries you can do in the eye.
Right.
Because the eye is small, and so they're just 3 is about the most.
Yes, this is not actual size.
No, it's not.
But okay, after surgery, I mean, what are the quality of life issues? I mean, is there good living with glaucoma? I mean,
we've it's not easy if you have progressive glaucoma, because a number of things affect the quality of your life. One is your balance. Another is glare. When you go out into a bright day, very often there will be glare. And
so, is that resulting from the disease or from the surgery, or either?
It results from the disease, because certain cells get lost. You lose your peripheral vision. You become, and also since it affects many people who are older, it seems to increase their susceptibility to falls, because they don't really quite see the sidewalk, for example, because you lose peripheral vision also. Your peripheral vision is all around the eye, and so you lose it. You don't see your feet.
Okay.
And so unless you're always looking around.
Right, which is, yeah.
And if you're busy talking to somebody as you're walking, you just may not see an impediment. So this is a problem. And we've had people who walk into glass doors. Now, I know people without glaucoma also walk into glass doors.
Yes. No comment.
Right. But I think it happens more frequently.
Yes, but we won't admit to it. And we do have another caller.
Okay.
We have Marie on the line. Marie, feel free to say hello whenever you're ready. We will take your question. Hello?
Hello, Marie.
Hi, I'm Marie.
Yes, Marie?
I have 2 questions.
Okay.
One, I'd like to know has anyone done any studies on makeup, eye makeup, and how it might hurt the eye? And the other question I have is about alternative therapies like acupuncture and chiropractic. I mean, I come from a type of thinking that kind of goes that way, and lots of people have been recommending that kind of thing to people that have glaucoma. What do you think about those two things?
All right, with using eye makeup, you have to be very careful when you use eye makeup, and this is for anybody using eye makeup, that there's no bacteria on the brush. There's a lot of bacteria on your lashes, and using the brush, using a makeup brush constantly on the lashes can aggravate this bacteria, and once it gets into the eye, you can get an infection. If you have glaucoma, it's even more difficult. So I would just not advise anybody who has glaucoma to use eyelash makeup. Certainly you can use it on your brows. Now, for alternative therapies, I've written about a number of them. And
actually, we were just about to get into that.
Okay.
So.
Yeah, you asked about acupuncture. It would be really wonderful if acupuncture did work, but there are other things that I find are more effective, and one of them is vitamin therapy. There's something that happens in the body called free radicals. I don't know if you've heard about that, but free radicals destroy cells, and they destroy cells by stealing an atom from another cell and disabling it. And when this happens, then you begin to lose cells. Now, the way to counteract these, actually you need the free radicals in some cases because it helps with the digestion process, but it can also be very harmful. And the antioxidants are very good to handle the free radical problem. And the antioxidants are the E and the C, and many of the Bs do that also. Then there are any number of herbs, herbal remedies that can be helpful. One particular one that is ginkgo biloba, which is used in Germany for treatment of the eye. Yeah.
Okay, and I think we've lost Marie, but we do have Richie on the phone now with another question.
Yeah, hi. I'm enjoying your program. It's very good.
Thank you.
And
what's your question?
I wanted to know: is there any specific age that glaucoma starts or begins, or could it affect anyone?
Other than the senior set, can it affect children?
Oh yes. Oh yes, babies get glaucoma. There's something also called juvenile glaucoma, and anybody can get glaucoma. When a baby gets glaucoma, it's very easy to see because they develop something called cow's eye. The eye bulges out, and that's because the sclera is very tender at this point and can swell. It becomes much more rigid as an adult, and so you don't get the cow's eye. But yes, babies get glaucoma, and they need operations almost immediately to handle their particular problem. There's a whole set of youngsters who have juvenile glaucoma, and actually juvenile glaucoma, it's called juvenile until you're in your 20s with glaucoma.
Okay.
And people, we have a support group, and a number of people in their 30s got glaucoma. There is a glaucoma called pigmentary glaucoma, And younger people get this, and this is pigment that in the eye, it comes off of the iris.
So that's where the color of your eye is.
Yeah, it's the iris is the color part of your eye. And the pigment comes off of the iris, and this gets into the trabecular meshwork.
Oh, so it sort of flakes off
Right.
and clogs the
Yeah.
drain, so to speak?
Yeah, it clogs the drain. This seems to happen more with young men because they have larger eyes. And so there's something called the zonules that hold the iris in place, and the brushing of these zonules it causes this flaking of the pigment.
Okay. Thank you for calling, Richie.
Wait, I didn't finish.
Okay, one
I have
more.
One more question. Is that okay?
Yes. Feel free.
I just wondered if diabetes, which affects the blood vessels in the eye,
Absolutely.
would that have anything to affect?
Absolutely. Diabetics have something called diabetic retinopathy, and this is an overgrowth of blood vessels, runaway blood vessels. Which can also cause glaucoma, and this is a very dangerous situation because diabetics can lose sight very, very rapidly.
Wow.
That's one of the leading causes of blindness in glaucoma is the diabetic retinopathy.
Wow. Thank you so much for that. It's very informative.
Right. Thank you.
Thank you. Bye.
Okay, and in just another second we have another caller who's going to be put through in just a moment. Edith?
I just had surgery for glaucoma in March with laser surgery. I just wanted to ask you a question.
Sure.
Is there anything I should stay away from as far as alcohol or foods or exercise, anything that would compound upon my glaucoma?
Exercise is excellent. Do as much exercise as you possibly can. And
For the eyes, I mean.
Aerobic is great. You can do anything you want with the eyes. Alcohol is another problem. They say that 2 drinks is okay because your pressure goes down with it, but unfortunately alcohol turns to formaldehyde in the system, and you really don't want to have that in your system when you have glaucoma. So I may be in the minority, but I feel that alcohol is not a good thing with glaucoma. Other than that, you can do anything that you want to do. Eat organic food, eat lots and lots of fresh green leafy vegetables, eat your kale, your broccoli. All of these are helpful. They all have the antioxidants in them that help to destroy the free radicals, which are important for the health of the eyes.
I see. What about the yoga exercises for eyes?
Yoga is fine, but don't do the stuff where you're standing on your head.
I see.
Don't stand on your head. Don't get your head down between your knees. Keep your head above. Yoga is actually, I think, a little bit better than karate because with karate you can get a hit in the eye, and you don't want to have that.
I see.
But yeah, yoga is wonderful because yoga, meditation, that's absolutely great.
Okay. I find that when I go out in intense sunlight, then I have pain. Or if I go to a party and they take pictures and they flash lights in my eye the next day, I have like a redness of the eye. Is that a problem? Should I speak to my doctor about that?
Speak to your doctor about that.
I appreciate it.
I don't have any opinion on that.
All right. Ms. Marks, thank you so much. I will gain your book, and I will read it.
Thank you.
Thank you so much.
Thank you.
Thank you for calling.
Bye-bye.
Bye. Alternative medicine can be helpful in conjunction with traditional.
Yes. I do not recommend that you stay only with alternative.
Should you keep your doctor in the loop as to what you're doing to...
I think it's a good idea. Doctors are now becoming more permissive about vitamin therapy, and they like to know what you're taking. And there are a number of vitamins now on the market that combine the antioxidants and something like taurine, which is very good for the eyes.
So it goes hand in hand with good nutrition.
It goes hand in hand with, and good nutrition is extremely important. Good nutrition, exercise. There actually are studies that show that aerobic exercise does lower the pressure.
So low impact, high impact. Can high impact be harmful?
High impact can be harmful if you have pigmentary glaucoma and exfoliation glaucoma, which is what I have. I have exfoliation, which means that the little white flakes somehow happen in the eye and they get into the meshwork. So in this case, high impact is not a good idea. But walking is wonderful. Walking is wonderful, and running in some cases is fine also.
So, but again, you should keep your doctor in the loop?
Oh, yes. Oh, yes.
So, and we mentioned positive foods that we should eat. Are there any things other than alcohol that people should avoid?
Well, I don't think fast foods are a good idea for glaucoma. One of the things that I would recommend, though, is essential fatty acids. Now, these are the omega-6s and the omega-3s. The omega-6s are the oils that you get from seeds and nuts, and the omega-3s are the oils that you get from herring and salmon and sardines and flaxseed. These are the wonderful ones.
Okay.
And the problem is that people get 20 to 1 with the 6s, and it should be really 1 to 1. So it shows you be very careful on your other oils.
Okay. And again, speak to your doctor. Even your regular physician can.
Your regular physician.
Help with good nutrition.
But more importantly, a nutritionist.
Okay.
In this case, I think a nutritionist is very important for people who have glaucoma.
Because, I mean, it can take both a physical and a mental toll.
Right, absolutely.
Which brings us into what kind of support is out there for the stress of all this, because it's a tough thing. I mean, it's especially initially a shock to the system, and it's an ongoing thing.
It's very difficult. We in New York are very fortunate to have a glaucoma support and education group, and it meets once a month at New York Eye and Ear on the third Saturday, and anybody is welcome to come. It's free, although we ask for a donation because we do publish a glaucoma newsletter, where we recapitulate what doctors have talked to us. We have a lecturer at every single session, and it's you can find out more about this by calling the Glaucoma Foundation,
which is area code 212-285-0800.
Right.
And is the information on the website as well?
The information should be on the website. I'm not sure it is, but the website is something very important to take a look at, because there is a lot of information there. And that's Glaucoma Foundation, www.glaucomafoundation.org. And it's they will eventually, it's part of the process now, be getting the various newsletters on there too. And people really do love the newsletters because it gives a lot of information.
A lot of information, keep you up to date on the latest things.
Yes, absolutely. Absolutely, yeah.
And different kinds of meetings. So, I mean, what different kinds of support groups are there as well?
Well, there are support groups throughout the country. Basically, the Glaucoma Support and Education Group in New York City is I would say, the most important one for people who have glaucoma. There are other support groups for eye diseases, but this is the one should go to, because there you can also meet people who have, surprisingly, who have your kind of glaucoma. At our last support group, we had a couple of men who came in with closed-angle glaucoma, which I didn't talk about. We'll have to do this another time.
Yeah, well, you can give a brief
closed-angle glaucoma is a functional glaucoma because it happens with the conformation of the eye, and it usually is helped by a tiny little operation done with a laser called an iridotomy that allows the fluid to go out. And it's the way the eye is structured, and it usually happens with people who are far-sighted because their eyes are smaller, so that they don't have quite as much room in the eye for everything to go on in there. It can be serious, and the way it can be serious, and this is important, is that if there is a blockage, if the iris moves into the angle, it will cause a blockage that can then have the fluid back up to such an extent that the pressure can go way up to 60 or 80 or something like that, and the person can lose sight in a day, actually lose the eye in a day. And so if this ever happens and you see halos and you have a headache and you know that something terrible is going on, you must
get
immediately
to a doctor.
go to a hospital.
Emergency room.
Emergency room, because that pressure has to come down immediately. And we have had cases in our group where this has happened, and a great deal of sight has been lost.
There is a wealth of information in your book, Coping with Glaucoma.
Thank you.
Can't tell you to run out and buy the book, but
it's also in the libraries.
Yes, but go to the library and take it out, take a look. It's there in your library for free. I'm not going to tell you to go to Amazon.com and get it, but it's at your library. And again, I want to thank you. We're going to have a nice long credit roll with all the information of the website and the phone number again, which I'm going to verbally give out now. It's the Glaucoma Foundation.
Right.
And the phone number is 212-285-0800. Mm-hmm. The website is all spelled out, glaucomafoundation.org, www.glaucomafoundation.org. And I thank you again.
You're certainly welcome.
And you've been watching Talking About Glaucoma. I'm Jon Griffith, your host. My guest, Edith Marks. And I hope to see you again real soon. Check out the show's website, www.talkingabout.info. And you can write to me at Talking About, Box 20713, Floral Park, New York, 11002. And I'll see you next time. Thanks. Good night.